Welcome, everyone. I am so excited to talk to you today about PDGF. We'll give patients another maybe 30 seconds or so, and then we'll get started. I also want to just let everyone know that if you have questions, you can go ahead and put them in the Q&A chat. And then at the very end of the presentation, I will answer those questions. We'll try to keep this webinar to about 20 minutes. And any questions that I don't get to today, I'll make sure that I reach out to you directly. Okay. So we're going to go ahead and get started. The very first webinar that I did with Westlake was on Sculptura, and this was about 6 months ago. And I am, despite not wanting to always do webinars or be on camera, I am thrilled to talk to you today about PDGF because PDGF is my favorite product to use in practice. There are so many uses for it. My patient results are amazing, and I will share some of those with you in a minute. But it's a really exciting new product. It actually just launched in April 2024 for its use in kind of cosmetics and aesthetics. And I was one of the very first providers at Westlake to be using it, particularly here in Houston. Before we even get going, to kind of kick things off and pique your interest, I want to share some of my first 2 patient photos with you. So, and these were my very first 2 patients for both scalp and under eye. So you can see this is my male patient, 35 years old. This was him 6 weeks post a singular treatment with 2 vials of PDGF for scalp. Pretty phenomenal, right? Prior to PDGF, we were using PRP for scalp or hair restoration. That's where we would take your blood, and we would centrifuge it down and buffer off this platelet-rich plasma and inject that into the scalp. Some providers, not me, were using PRP for under eye restoration as well, but the results weren't great. It would take sometimes 5 to 6 treatments to even start to see results. And you can see this female patient, it's actually my sister here, 42 years old, and this is 12 weeks post her second under eye treatment with PDGF. She also did microneedling at the same treatment, and you can see just the changes to her pore size, look through her forehead and cheeks. So with these being my first 2 experiences with PDGF, I was blown away. All right, so let's get into what is Ariessence PDGF. So the product Ariessence is actually pure PDGF, which is platelet-derived growth factors when it's combined with sterile, high and low molecular weight hyaluronic acid. And we use it specifically for microneedling as a glide serum that we push down into the dermis of the skin, or it can be applied directly to the face or tissue after a laser, after surgery, or any other procedure trauma to the skin. PDGF itself is a potent growth factor that's contained in a cell in your body, and that cell is called a platelet. Until there is a site of injury. And when we have an injury, these platelets in our body start to aggregate or come together and release these growth factors to heal our tissue. PDGF is manufactured according to exact pharmaceutical standards that ensure that every batch and every lot is pure, potent, predictable, and proven. And you'll see that on their logos. But I really want to touch on each of these points briefly. So when we say that this product is pure, PDGF uses recombinant technology. This is the same technology that's used to make insulin for diabetic patients, whereby a human gene is inserted into yeast, and then that yeast is modified to produce a singular protein. And that protein is PDGF. It is potent, meaning powerful. So how powerful, right? I have patients ask me all the time, what about PRP? How much better is this than PRP? It is up to 300,000 times higher concentration of growth factors than what we were getting from PRP or PRF. So in my opinion, those are things of the past. If you've done them in the past, I did too, and I got great results with it. So just imagine what you can get using PDGF. It's also predictable. So the pharmaceutical grade sterile nature of PDGF eliminates any variability associated with if we were taking your blood, right? Because if I was taking your platelets and trying to derive growth factors, it could depend on, were you sick recently? How old are you? What is the quality of your platelets? But we know that this quality is predictable when it's lab derived. And finally, proven, this is the most well-studied tissue growth factor in regenerative medicine. So there are literally thousands of peer-reviewed journals about PDGF, encompassing over 100 clinical trials involving it. It's the only growth factor that has 4 FDA approvals for separate medical uses and 16 years of proven therapeutic use in medicine. It is just new to the aesthetic world. Let me see, we're getting to our next slide here. How it works. Okay, this video, I don't want to nerd out on you too much, but I want you to watch this video. This is a needle that's being inserted into the extracellular matrix, and oh, there we go. And it is delivering PDGF. What you're seeing when you see these little biofluorescent particles moving towards it are actually stem cells. And these stem cells, look how they are moving towards that PDGF. They are finding it, like fish to bait, right? Do you see them just coming in every time that PDGF is dropped? So when we put PDGF into your tissue, into your extracellular matrix, we are essentially supercharging your body's own responses in the tissue. Let's touch briefly on some of the other mechanisms by which PDGF works. It also, so besides attracting regenerative stem cells where PDGF is injected, like I mentioned, it stimulates the growth of stem cells among 23 different potent growth proteins. It stimulates collagen types 1, 3, and 6, and fibronectin in the tissue. One thing that I love about this product that you will notice if you use it for microneedling on the face, or if you use it in the under eye area, is that it increases your body's own hyaluronic acid up to 800%. So that tissue looks plump. Even after microneedling 2 days, your skin is glowing, it feels bouncy, your under eye stays feeling really supported. And finally, it enhances new blood vessel formation. So think of these blood vessels as how we get food source to our cells, right? Blood is what feeds these cells. So that's why when people take oral minoxidil, they get new hair growth, right? It's a vasodilator. When we inject it into the scalp, we inject it into the tissue, you get all these new blood vessels that help deliver this food to these growing cells. Okay, clinical applications. I'm going to show you patient photos. I'm going to talk to you briefly about some of these applications, including like downtime, the healing involved, and then I'll even share some of my own photos for you since I have definitely played around with this product. We use it for microneedling, we use it for under eye restoration, and we use it for hair restoration. And we also use it post-surgically or post-laser. Before we do that, I just want to touch on why I prefer PDGF and why it's so superior to PRP and exosomes. I hear a lot about exosomes, and I don't know if y'all are on the same social media algorithms as me where you see a lot of cosmetic things, but I like to say that exosomes are just like these extracellular grocery bags that carry things, okay? What they carry can be helpful or harmful. So it could be a grocery bag full of veggies, or it could be a grocery bag full of potato chips. So just because a company says that they carry 50,000 exosomes, for example, that tells you nothing about what they're carrying and if it's actually beneficial to your skin. So when we compare PDGF to PRP or exosomes, some of the highlights are we don't have to take your blood. It is consistent, and like I talked about, it is proven. And there's less variability with these things. There's also less risk of contamination, and there's less risk for infection. So here's video I'll show you of me microneedling with PDGF. You can see that I'm applying the PDGF mixed with that hyaluronic acid onto the skin. And then I use that skin pen device to push it down into the dermis. Sorry if that grinding is loud. I always tell patients, microneedling sounds worse than it feels. When we do this treatment, I always say that we do 1 vial and we mix it with the hyaluronic acid serum. But I tell patients, plan to do multiple treatments. Every treatment that you do of microneedling will give you 3 to 4 months of collagen stimulation. When we stack those treatments and you do 1 treatment and then and you say anywhere between 2 to 4 weeks later, you do a second, and then 2 to 4 weeks later, you do a third, you will be amazed by the improvement in your skin texture and quality. It's one of the few things that actually changes pore size as far as procedures go. It improves the tone and texture, and there are a lot of clinical articles about there that talk about its reduction in scars and wrinkles. But remember I said PDGF increases your hyaluronic acid by 800% in the tissue. I say the glow is real, okay? When you use this product, and the benefits of using it is that you have much less downtime. So it decreases some of that heat, that redness, pain, discomfort that's associated with microneedling. I will microneedle my face on a Friday, and by Saturday, even Sunday, with a little bit of tinted mineral sunscreen, no one even knows I had anything done, especially when I use PDGF. Let's go to our next slide. Okay, under eye rejuvenation. Here are some photos of me. This is probably the most exciting treatment that has come out with PDGF that I get asked the most about in clinic, and probably that I've done the most of, because prior to this product, we didn't really have anything other than under eye filler. Patients are really excited to have something for under eye because, you know, having your under eyes look plump and not dark is the difference between, for me, a day that I'm not at work, not feeling like I have makeup or want to wear makeup or have anything to cover, right? For treatments, I tell patients plan on 2 to 3 treatments, and we space them 4 to 5 weeks apart. The maintenance can be maybe 1 to 2 vials a year. This product is really new, and using it this way is new. And so I tell patients, we'll just have to see, right? But I do remind patients that the collagen formation that you get from this treatment, you get to keep. Time marches on, right? And we lose 1.5% of our collagen a year. But my thought is this should last you longer than filler. And it also gives you a much natural result. So this is me after 2 treatments of under eye filler. Of PDGF. I will say what I notice most about my eyes is the support that I feel in my under eye area. So I used to be able to kind of push on the skin and it felt like just a thin layer of skin on bone. Now I feel like it's supported. I don't have that same step off in my under eye. Ignore this overhead lighting, but you can definitely see some changes there. This is the conversation that I always have with patients when they want to do the under eye treatments, is I tell them, you have to plan for downtime, okay? You're going to be swollen, you're going to have some darkening, some bruising, and results are slow. So right around 4 to 5 weeks, you'll start to see that improvement in your under eye, but plan that you can be purple or dark. You can see in these photos, that was me at 1 week on the top, and then that was me at 2 weeks. The procedure itself is very comfortable though. I put numbing or lidocaine under your eye, and then we're actually able to mix that PDGF. We mix it with some saline, and then we also mix it with some lidocaine. So as I'm injecting you, you're really comfortable. Patients always say the same thing with the very first injection because they're nervous, and as soon as I inject their under eye, they go, oh, that wasn't so bad. So patients seem pleasantly surprised. This is a patient of mine whose photos I love to share. She was also one of my early PDGF patients. She was someone who was considering a lower blepharoplasty or a fat transfer because she really didn't like that step off under her eye, as well as some of that pigmentation and hollowing. These photos, actually these first 2 photos that you can see where her skin tone's a little different, there was a different backdrop on those photos, but those photos were taken just 5 weeks apart, if you can believe it. I couldn't. She came in and she just looked incredible. She decided at that time, she was like, yeah, if this is what I look like with one, let's do it again. We did her second treatment. And then you can see in these photos on the right with the same background wall, the difference between her at baseline and her after 2 treatments at about the 10-week mark. She was thrilled. Okay, hair restoration. I have had a lot of patients just show up on my schedule, booked online without a consultation for PDGF for hair restoration, because they are patients who have kind of done their own research. They've heard about it. They know that we offer it, and they just book it and show up. But I do tell my patients, I recommend coming in for a medical visit where we can talk about your hair loss first and evaluate if there's any underlying conditions that are contributing to it. So that means treating any underlying vitamin deficiencies, hormonal imbalances, talking about stress or other reasons why you might have lost hair recently, and seeing how we can support you. For hair restoration, it is 2 vials a treatment. And I say we do 3 treatments that are spaced 4 weeks apart, and then once to twice a year for maintenance. Patients should arrive early. I put lidocaine on your scalp. I mix this product with lidocaine, so you do get, you know, it's much less painful than PRP, which we couldn't mix with lidocaine. And patients are instructed to avoid exercise, hot showers, all of those things for about 3 days post-treatment. This is showing the scalp of a patient of mine who did 2 treatments. He's younger, he's in his late 20s. And this was him at about the 12-week mark after doing 2 treatments. You can even see the change in the quality of hair. Look how his hair is like shinier, healthier hair. I notice that a lot with my patients, particularly my female patients, when we're injecting here through the temples to help women get new hair growth. As that hair grows back, it's not as coarse or brittle, it's soft. And also, patients that have gray hair sometimes will notice that there's like their hair comes back to their natural pigment. Okay, finally, post-procedural application. This lovely patient of mine did the ultra clear laser. If you haven't watched the webinar on ultra clear, Dr. Kim did a wonderful one. But this laser's remarkable. Look at her neck. What you also notice about her is her skin glow and quality. This patient of mine wanted to use the PDGF post-procedurally. So after her laser, we mixed it with the hyaluronic acid. We placed it on the skin for her. And what it does is it speeds your recovery. It soothes the skin. It decreases redness, discomfort, and it amplifies collagen stimulation, right? And that's what we want. That's why we're doing these lasers. We want those resurfacing benefits. We want our skin to look tighter. Look at her neck. It looks amazing, right? I will say that this patient, which I wish I had the photo, sent me a photo of her face on day 7 or 8 post-laser. She looked amazing. And when she sent me the photo, she was the first patient that I had applied PDGF topically post-procedural. And I thought I probably should have done harder laser settings on her because she didn't look bad enough on day 7 compared to my mother, for example, who did not get the PDGF. This patient healed beautifully, and then this is her seeing her at the 2-month mark follow-up. Just look how great her skin looks. She looks 10 years younger. We're getting close to the end here. I just want to touch on a few takeaways, right? PDGF is pure, potent, predictable, and proven. Patience and persistence is key, right? It can take time. So pictures are really important. I always make sure I get great photos of my patients so that you can see the changes in your skin or your scalp or under eye or whatever area we're treating. And I always tell patients, come back. You know, that's what those second treatments are for. That's why I tell patients, plan on 2 to 3 under eye treatments to get you to your goal. Plan on 3 to 4 scalp injections, and you will get results. Finally, PDGF works with other biostimulators like Sculptra, lasers like the Ultra Clear, V-Beam, Fraxel, CO2, all of those that we do in our practice, and fillers and Botox. So if you want comprehensive rejuvenation of your skin, using all of these products together is really what's going to give you the best result. Okay. If you want to book your own session or consultation, you can call our office number listed here. You can also get online and book an appointment. I work out of both the West University and the River Oaks offices, so you can contact Michaela, our manager, at our River Oaks office, and you can contact Ashley here at our River Oaks office, and I would love to see you. And I also just want to tell patients you can get $100 off each vial of PDGF used with your first treatment for attending this webinar. So I did have a patient yesterday who did scalp, under eye, and microneedling all in one session. I've never used that many vials of PDGF before. She was kind of genius to do it that way, actually do all of her downtime at the same time. But if you want to do that, I will give you $100 off each of those vials. So talk to me if you want to learn more. All right, let me check and see what questions we have. Okay, do you inject under eye or do you microneedle under eye too? I do both. So if I'm microneedling your face, I use that PDGF and I microneedle it really high up on the under eye because I want to get that skin tightening and collagen. My patients do them at the same time. So I have patients who will microneedle full face and then do their PDGF injections at the same appointment. That's what I have done for myself for my 2 treatments. That's probably my favorite combo treatment because you're already going to have downtime. So it would be 2 vials of PDGF, 1 used for the full face microneedling. I will definitely go over that under eye, and then after I go in and do your under eye injections. The next question I got is, I've heard that you need to get any under eye filler dissolved before getting PDGF. And this patient had under eye filler about 2.5 years ago. No, that's not true. When it comes to under eye filler, if you have good under eye filler, meaning if your under eye filler doesn't look lumpy or bumpy in the area, you can leave it. I would go right in and do that PDGF. If your under eye filler doesn't look good, and I will help you make that decision, then we can just go in and do the PDGF. They do not interfere with one another. But I will say, if you have bad under eye filler and we do PDGF and you're pulling in all of this extra hyaluronic acid and water, it's only going to kind of magnify that unevenness of your under eye filler. Okay. And next question. Do I apply with a needle or cannula? I place PDGF with a needle directly onto the periosteum when we're under eye, and that's been recommended, I would say, by not just our reps, our Ariessence injector reps, but all of the main injectors here in Texas that have been using it do the same approach because we want it right on the bone. Okay. And is it available in Austin? Yes, it is available in Austin. There are lots of wonderful providers there that have been doing PDGF under eye. Maddie Gantz does it, Dr. Prather, who else? Kelly Walla. They are all doing it there. So you're welcome to go see some of our other great providers in the area. Oh, okay, good question. What are the potential side effects or adverse reactions? When it comes to PDGF and we are microneedling it into the skin, there are not any adverse reactions that will happen with PDGF in that way. Unless for whatever reason you have a hyaluronic acid allergy. I've never seen it, never heard of it. It shouldn't happen. When it comes to side effects that I personally have seen, and I would say I've probably done the most of this of many of the providers in Westlake. The one adverse effect that I saw, thankfully, happened on my sister, who I showed you her beautiful photos. You will see online, I saw kind of this Instagram clickbait about PDGF forming these nodules under the eye by a doctor who does those injections, and she was trying to anyways, sell something to help you with it. My sister got a couple little red bumps on her second round of injections under her eye. That happens when the injections are too superficial, when they're not on the periosteum, and you have to give it time. That's it. You can sometimes go in, if it's really bothering a patient, and put Hylenex in there to break up some of that hyaluronic acid, but I don't want to inhibit their results. So my sister and I kind of had a conversation about it. She was totally patient to wait. She had already done the first one and done great. And by her really her 9 week from her first injection, but by 5 weeks after her second, it was gone, and you saw those photos. So if you hear anything about getting little bumps developing under the eye, I've seen it. My sister had it. It clears. All of the answers that I've gotten from other injectors, so just give it time. Warm and cold compresses to the area can help you out. And then the other adverse response that I've seen was a patient of mine who has an allergy and didn't know he did to topical lidocaine. So we put topical lidocaine on, went in to microneedle him, and he had to see me in clinic and get on some oral steroids to help calm down that contact dermatitis. What other questions? How much are the vials? So the vials are, and how long do they last? We talked about you get your own collagen. Whatever collagen you get to keep, but you will lose 1.5% a year. So we're still figuring out how long results will last for under eye. The vials themselves depend on the provider and what they're doing. For me, I do $800 a vial for under eye injections. I know in Austin it is more expensive. It's $1,000 a vial. The reason I have kept it lower is because I really want patients to kind of trust the process of doing one and coming back 4 to 5 weeks later and doing the second. Whether that $200 motivates them, I don't know. I feel like it would motivate me, but I tell patients that's why I'm giving them that price. If you're doing scalp injections and we're using 2 in 1 sitting, it's $1,200 for scalp injections per treatment. And Westlake runs, specials on these every couple months. So right now you're already getting a discount. So let's get you started on your first. And finally, is it safe to get PDGF while breastfeeding? Yes, it is absolutely safe to do PDGF while breastfeeding. So we can microneedle PDGF. We can inject PDGF under your eye. That is all safe during breastfeeding. So, and that's exciting because if you're like me and you had a baby, you're very tired all the time, and no one needs under eye help more than a new mom. Okay, that's it. Any other questions that I didn't touch, I will get back to y'all. I really appreciate you all attending and hope to see you in clinic.